Breast reduction surgery is very safe, and fortunately the complication rate from breast reduction surgery is very low. However, all surgical procedures carry risks, and breast reduction is no exception to that rule. There are general risks associated with any operative procedure, and they include things like bleeding, bruising, wound infections, the potential for healing problems or bad scars, the possibility that the breasts might not be identical to each other, or that the patient might experience a collection of blood or fluid inside the breasts. Rarely there are anaesthetic complications, including clots in the legs, clots in the lungs, and issues with the anaesthesia that could in fact be life-threatening. To date, I've never experienced any significant complications from breast reduction surgery. The specific risks of breast reduction include things like nipple necrosis. Now that's where the blood supply to the nipple is interrupted and the nipple can die. To date, I've never had a patient that the nipple has died, though I have had some patients with very, very large reductions where the blood supply hasn't been adequate completely for a few days and some of the surface skin has occasionally been lost. This has never caused any significant issues with the cosmetic or functional appearance of the breasts. Other potential risks include sensory changes to the nipple, which although common are usually quite transient, and most patients will have relatively normal feeling by around the 3 to 6 month mark. Dog ears are little puffy bits at the end of the scars, and usually they'll settle down by the 12-month mark. If they don't, then often they can be removed under a local anaesthetic, and that doesn't cost the patients anything if they have private health insurance. Bottoming out is a condition where the weight of the fat inside the breast exceeds the stretching capacity of the skin, and so the skin tends to stretch in the bottom of the breast and the weight of the breast drops. That causes a heavy appearance to the bottom of the breast, and very occasionally that requires a revision to reduce the weight of the bottom of the breast. And once again, I don't charge patients for that, although it has nothing to do with how the surgery was performed. Finally, patients can experience something called fat necrosis, where the fat or the gland that's left behind doesn't have a rich and healthy blood supply, and they can present sometimes with tender lumps in the breast. Often that'll settle down and the lumps may well disappear, but it can take a little bit of time, up to a couple of years, for that to happen.